And things are also looking up for veterans living in the eastern part of our state. In the fall of 2021, a brand new 172,000 square foot outpatient clinic will open in South Tulsa. We were the first news operation to be allowed inside for a look at the ongoing construction and learn more about the new facility and how it will lead to better health outcomes for our veterans. The new Ernest Childers VA Healthcare Clinic represents an idea 7 years in the making. 15 months from now, this South Tulsa building site will be transformed into this, a $96 million facility that will offer greatly expanded services to veterans all under one roof.
The need for this clinic is great here. Currently, we have 3 separate clinics that service this area, and we have a hospital down in Muskogee. It will have primary care, mental health, dental services, optometry, a new infusion clinic. We will do endo procedures here and provide a wide array of specialty services that we don't currently offer in our Tulsa market, as well as new women's health services, new radiology services, and just have much more expanded capacity to be able to serve a large number of veterans.
Jonathan Plasencia is the Associate Director of the Eastern Oklahoma VA Healthcare System. Improving treatment options and preventive therapies for veterans living with mental health issues was a key priority in the design of this new clinic.
It's going to provide more care for our veterans so we can catch things early on and help prevent some of those unfortunate situations we've had. As you know, suicide among our veterans has been an issue, and it's something we really take at heart.
As is offering a wider variety of services specifically for women, who represent a rapidly growing segment of the military. During the Vietnam War, 7,000 military women served in Southeast Asia. In 1990, 40,000 served in Iraq. Post 9/11, 700,000 women have enlisted and served in the military.
This is the women's clinic. It's hard to envision right now because it's not fully framed out, but this will be a private waiting room.
Women's health, illnesses, breast cancers, cervical cancers, issues with, related to PTSD. So just having an increase in our access here, right here in Tulsa and the surrounding areas, is going to help us catch things earlier.
All of this at a time when the percentage of patients who say they trust and approve of their VA health care is improving dramatically. According to numbers provided by the Veterans Administration, that approval rating currently stands at 91% in Oklahoma.
We've been discussing and seeing a lot of improvement all the way from the pharmacy to getting care to the veterans, making sure the veterans are happy with the care that they're getting and receiving.
The trust that veterans have in the VA and the care that we provide has never been higher. So I would absolutely agree with you that the quality of the care continues to improve and will continue to improve.
The Mission Act has played a key role in that transformation. Passed in 2018, it allows veterans to seek care outside of the VA if it is needed, giving them greater access to treatment options that are best for them.
I think we're seeing a gradual improvement. One of the biggest concerns I have was improvement in the morale of the staff, because the staff, it's kind of like mama. If mama ain't happy, ain't nobody happy.
And that just streamlined our ability to not only provide care in-house and continue to strengthen the services that we provide here internally, but also the way that we're able to send veterans to the community if they do need care.
With the grand opening in 2021, the need to go elsewhere will be greatly reduced. This clinic will have its own compounding pharmacy, blood lab, eye and dental clinics, 92 exam rooms, a 2,000 square foot physical therapy area, and a state-of-the-art radiology department.
By the time this facility opens up, we'll have one of the best CAT scan machine in the entire state. So we are really providing quality care, quality procedures for our veterans.
The current outpatient clinic doesn't have a CAT scan machine. Patient parking is difficult, and as you can see, the needs have simply outgrown the capacity of the building, and the COVID-19 pandemic has only made the situation more challenging.
We've definitely noticed the concurrent jump among our veterans that we've seen out in the community in terms of positive COVID cases. and a lot more concern among our veterans as well. So we're getting a lot more people coming into the clinic requesting to be tested, and we're accommodating them.
Safe to say, these halls and walls can't get framed up and finished fast enough.
It is roughly 3 times the size of our current footprint here. And just the additional amenities of the parking lots, the ease of access in and out of the facility will just make it a much better experience for the veterans that will be coming here. They'll be able to get everything done that they need to underneath one roof, which is a tremendous benefit when you're accessing your healthcare services.